Hi, here on the Bible Forum. I'm Warren Sprouse. We're every Sunday night from 8 to 10 p.m. Eastern Time, live. If you want to get in the chat room, want to get in front, want to ask a personal question perhaps. But I want to talk to you tonight about COVID and reality. The facts in this argument come from a website called zerohedge.com. The history behind all of this describes people infected with a serious new communicable disease. They arrive from another country into our country and begin to infect other people. We're told a 2-week shutdown was the best way to be sure and save lives. But no sooner did we do this than the experts begin telling us it's not enough. Apparently they underestimated the scourge, or they thought they could defeat it, finding a cure. A man, an eminent doctor, arrives on the scene to tell us how all this works. He fails to tell us his wife works for the Chinese company responsible for this new disease. Then the restrictions begin to increase. Contact tracing is introduced in some states. Contact tracing is when, should you want to go back to work or go out for dinner or whatever, you're required to list all the people you've been in contact with for the last month or so. Then people started dying. Not the young and healthy, although there were some, but the older and less healthy. And if they had the coronavirus in their system when they died, that would be labeled the cause of death, or at least a contributor. Think George Floyd, the Minneapolis man who died at the hands of a police officer, but he had coronavirus at the time. He's on the list. That's what went on his death certificate. Probably not the primary, but it's there. And it's now in the daily statistics of coronavirus deaths. And the death rate skyrocketed, as they say, out of control. So we shut down businesses, largely small businesses. In the end, 60% of businesses closed are not expected to reopen. Most of these are small businesses, mom and pop, local kinds of things. The toll to date is said to be over 200,000 Americans. And while towns and small businesses suffered, Amazon's been making a killing. They say we have managed to invest a tremendous amount into a small number of businesses, including the financial sector. And of course, with business, money, comes power. And then there's the reporting. Apparently, anyone who died during this period from any disease or malady who tested positive for COVID is said to have died from COVID. And that pushes up the COVID statistic and results in more restrictions and greater fear. During the lockdowns, suicides increased, drug overdoses, alcohol-related deaths, tuberculosis infections, not to mention spousal abuse and child abuse. And how many people died for lack of treatment from all sorts of diseases and maladies simply because the medical community was either distracted or limited due to corona? Not to mention people who will not venture out, let alone to a doctor or a hospital. In September, the CDC was reporting that of the 161,392 deaths from coronavirus, 94% also listed some other condition: respiratory illness, coronary issues, underlying chronic health conditions, sepsis. Only 6% of the cases was COVID-19 listed as the only cause of death. Of course, death certificates generally list the primary cause, as well as a few potential contributing factors or conditions, and COVID was certainly a contributor. But why did these patients get it in the first place? probably because they couldn't fight it off. But that doesn't make COVID the monster we're being led to believe. A conservative news and opinion website named Revolver conducted an extensive study and found that COVID contributed to over 10 times the amount of deaths as did the disease itself. And sick people fared the worst. Global debt ballooned, growing to $20 trillion since the lockdowns began, according to the Institute of International Finance. And this is thought to be the biggest increase in debt in world's history. Perhaps worst of all, none of this is ever explained to the public as being necessary, if it's acknowledged at all. The reality here is that COVID is not nearly as dangerous as we're being led to believe. Accidents, gunshots, motorcycle accidents, people who fall off a ladder had drug-related heart attacks have all been counted because they had COVID in their system. Some hospitals were told simply diagnose patients with COVID because it pays better than what they really have. We're told the experts still don't know how much much about COVID, except that if you are already ill when you come in contact with it, or you are in poor health, including obesity, the odds of you contracting it and even dying from it increases by 48%. Add all this to age. Young people rarely die from COVID unless something else is going on. A large study conducted on data from cases in South Korea, Italy, China, Spain, 3 of the early breeding grounds for the virus found a 0% death rate for those under the age of 9. The death rate didn't climb above 1% until the age of 50 to 59. And then only in China and Italy, and only just barely at 1.3% and 1% respectively. So why did we shut the schools down? Probably out of ignorance. But then maybe there was a purpose to that too. The death rate climbed slightly above 1% for all 4 countries in the 60-69 age bracket, staying below 2% in South Korea and Spain, but below 4% in Italy and China. Death rates then spiked dramatically for those over the age of 70. This corresponds to what we see in our country. Very few deaths under the age of 18, just a little over 600. Slightly more for the 18 to 49 group, 2,803. Another modest jump between 50 and 64, 6,751, for a total of 10,154 people. But there's a huge spike for people over 65. Over 50,000 of those people have died. The overall death rate for COVID-19 nationally is 1.5%, regardless of age, with an average season's regular flu killing about 0.1% of anybody who might get it. Closer to home, we're finding that there's absolutely nothing to be concerned about for most healthy people. The COVID survival rates, according to the CDC, are 99.997% for those under the age of 20, 99.98% for those between the ages of 20 and 49, 99.5% for those between the ages of 50 and 69, and even 94.6% for those over the age of 70. And because of this, we have veritably shut down the country. These numbers include people with comorbidities, such as respiratory diseases and the like. And even these numbers are likely off, as only 6% of all COVID deaths are attributed to COVID alone. The rest had, on average, at least 2 comorbidities. The average death rate annually for the flu is 0.1%. It's worth noting that this data all comes from the early stages of the pandemic, when medical professionals had little way of treating the disease other than ventilation and thus probably killing in the severe cases. Now we know quite a bit more about the therapeutics that aid in recovery. President Trump, a clinically obese 74-year-old man, recovered from the disease in less than a week. There's ample evidence that the disease is becoming less deadly, not more so. Death rates fall because of increased testing, but the median age of infection has likewise gone down. All of this has the smell of politics, or money, or power, not medicine.